Congratulations on starting your journey into nursing. That's a big step, and you should be proud. Today, we're going to break down one of the most important things you need to succeed: how to think like a nurse. By understanding the nursing process and the clinical judgment model, these two frameworks are the foundation of nursing school, the NCLEX, and real-world practice. Nursing is more than memorizing facts. You're going to face real patients with real problems, and you'll need to make safe, effective decisions, fast. That's why you need both: the nursing process, your structured step-by-step foundation, the clinical judgment model, your real-time, practical thinking guide, especially important for the next generation NCLEX. Let's start with the basics. The nursing process is a systematic approach you'll use every day in patient care. Assessment. Collect data, vitals, labs, observations, diagnosis. Interpret the data to identify the problem. Planning. Set measurable goals and plan interventions. Implementation. Carry out the care plan evaluation. Assess if the goals were met and what comes next. This framework helps keep care organized, safe, and patient-centered. But real nursing isn't always linear. Patients change fast, and the NCLEX knows that. So the next generation NCLEX, NGN, now tests clinical judgment using real-life scenarios. The clinical judgment model has 6 steps. Recognize cues. What information matters most? Analyze cues. What do those cues suggest? Prioritize hypotheses. What's the most urgent problem? Generate solutions. What are your intervention options? Take action. Choose and implement the best response. Evaluate outcomes. Did it help? What's next? It's about how you think like a nurse, not just what you know. Here's the connection. The nursing process teaches you what to do. The clinical judgment model teaches you how to think through it in real time. Let's apply both in a quick example. Scenario: your post-op patient is short of breath. O2 satiety is 88%. They look anxious. Assessment: recognize cues, low O2, anxiety, shallow breathing. Diagnosis: analyze cues, could be a PE or respiratory issue. Planning: prioritize hypotheses, act fast, PE could be fatal. Generate solutions: give oxygen, raise HOB, notify provider. Implementation: take action, do the intervention. Evaluation: reassess vitals and patient comfort. That's how you think like a nurse: connecting data, prioritizing quickly, and taking action with confidence. To get better at clinical judgment, here's what you should do. Practice NGN-style case questions. Use the nursing process during care plans and simulations. Reflect on your clinicals. What worked? What didn't? Talk through case studies with classmates or mentors. Always ask, what am I seeing and what does it mean? Clinical judgment is a skill. It's learned through repetition, reflection, and real-life application. If you're just starting out, don't worry. It takes time to think like a nurse. The more you practice, the sharper your instincts become. The nursing process gives you structure. Clinical judgment brings it to life. Keep learning, keep questioning, and trust that every patient you care for is helping you grow. Thanks for watching, and remember, you've got this.